If you are over 60 and still believe that a few simple stretches every morning are enough to keep your body healthy, many orthopedic surgeons say that belief could actually be putting your joints at risk. Stretching has been promoted for decades as the ultimate solution for stiffness, back pain, and aging muscles. But modern research in orthopedic medicine shows a very different picture. According to specialists who work with seniors every day, stretching alone does very little to protect the structures that actually determine mobility after 60: your joints, cartilage, tendons, and stabilizing muscles. In fact, some doctors warn that relying only on stretching may give people a false sense of security, while the real causes of joint degeneration continue progressing silently. Think about it this way: flexibility is only one small piece of the mobility puzzle. Many seniors can still touch their toes, yet struggle to climb stairs, stand up from a chair, or keep their balance. That happens because aging doesn't primarily attack flexibility, attacks joint stability, muscle strength, and the connective tissues that protect your skeleton. Orthopedic surgeons frequently see patients who stretched every day for years but still developed knee pain, hip stiffness, or chronic lower back problems. The reason is simple: stretching lengthens muscles temporarily, but it does not strengthen the structures that hold your joints together. Without strength and stability, joints begin to absorb more stress with every step you take. Over time, that stress slowly wears down cartilage, irritates tendons, and increases the risk of arthritis and injury. And here's something most people don't realize. After the age of 60, muscle mass naturally declines by up to 3 to 8% every decade if you don't actively train it. That loss of muscle, known as sarcopenia, is one of the biggest reasons why older adults lose mobility and independence. Stretching does almost nothing to slow this process. That's why many orthopedic specialists now recommend a completely different morning approach for seniors who want to stay strong, pain-free, and active well into their 70s, 80s, and even 90s. In this video, we'll reveal the exact types of movements orthopedic doctors recommend instead of simple stretching, why certain gentle habits may actually weaken your joints over time, and the small daily routine that can dramatically improve balance, protect cartilage, and help your body move the way it did years ago. If you want your knees, hips, and back to keep supporting you for decades to come, what you're about to learn may completely change the way you start your mornings. But before we talk about what actually protects your joints after 60, orthopedic surgeons say it's important to understand why stretching became so overrated in the first place. For decades, stretching was promoted as the universal solution for stiffness and injury prevention. Fitness magazines, physical education classes, and even many early rehabilitation programs taught people that loosening muscles would automatically protect the body, while stretching can temporarily reduce the feeling of tightness. Research now shows that tightness is often not the real problem. In many older adults, what feels like stiffness is actually the body's protective response to weak stabilizing muscles around the joints. When those muscles become weaker with age, the nervous system tightens surrounding tissues to prevent instability. In other words, the body creates tension to protect itself. When someone stretches that tension away without strengthening the underlying muscles, the joint can actually become less stable. This is one of the reasons orthopedic surgeons frequently see seniors who stretch daily but still develop knee pain, hip discomfort, or lower back issues. The joint simply lacks the muscular support it needs to distribute force safely. And once joint stability begins to decline, everyday activities that once felt effortless start placing far more pressure on cartilage and ligaments. Something as simple as standing up from a chair, stepping off a curb, or walking downstairs can create several times your body weight in pressure across the knees and hips. When stabilizing muscles are weak, that pressure is absorbed directly by the joint surfaces instead of being controlled by the surrounding muscles. Over time, this increases inflammation, accelerates cartilage wear, and raises the risk of osteoarthritis. Another overlooked factor is balance. Many seniors believe flexibility keeps them mobile, but orthopedic doctors say balance and joint control are far more important predictors of independence later in life. Studies show that adults over 65 who maintain strong stabilizing muscles around the hips and core are dramatically less likely to experience falls, fractures, and mobility decline. Falls are actually one of the leading causes of injury and hospitalization in older adults, and most of them are not caused by poor flexibility. They are caused by weak muscles, poor joint stability, and slow reaction time. This is why modern orthopedic programs for seniors now emphasize what doctors call active mobility, rather than passive stretching. Active mobility means teaching the body to move through a comfortable range of motion while the muscles actively support and control the joints. These movements train strength, coordination, and stability at the same time, which protects cartilage and connective tissues far more effectively than simple stretching ever could. And the best part is that these movements don't require a gym, heavy equipment, or intense workouts. In fact, many orthopedic surgeons recommend starting with just a few minutes of specific joint-activating exercises each morning. These movements wake up the muscles that stabilize the knees, hips, and spine, allowing the joints to move smoothly throughout the day. In the next section, we'll look at the first simple movement, orthopedic. Specialists often recommend, for adults over 60, a small exercise that can dramatically improve knee support and reduce joint stress with every step you take. One of the first movements many orthopedic surgeons recommend for adults over 60 is something surprisingly simple, yet incredibly powerful for protecting the knees and hips. It's called controlled sit-to-stand training, and it directly strengthens the muscles that support some of the most vulnerable joints in the body. At first glance, standing up from a chair may seem like an ordinary daily action, but biomechanically, it is one of the most important movements for maintaining independence later in life. Every time you rise from a seated position, your body activates the quadriceps in the front of the thighs, the glute muscles in the hips, and the stabilizing muscles around the knees and core. These muscles work together to control the load that travels through the knee joint. When they are strong and coordinated, the pressure on cartilage is distributed safely. When they are weak, that same pressure becomes concentrated directly inside the joint. Orthopedic doctors often explain that many cases of knee pain in older adults are not caused by the knee itself, but by weak hips and thighs that fail to support it. When the glutes weaken with age, the knees begin to collapse slightly inward during movement. Over time, this small shift in alignment can place enormous stress on the inner structures of the knee, accelerating cartilage wear and increasing inflammation. This is why strengthening the muscles around the hips is one of the most effective ways to protect the knees. The sit-to-stand movement trains exactly this system. But the key is performing it slowly and with control rather than simply pushing yourself up quickly. Orthopedic specialists often advise seniors to sit toward the front edge of a stable chair. Place both feet flat on the floor, shoulder-width apart. Lean the torso slightly forward, and then rise slowly using the legs rather than pushing heavily with the hands. The goal is not speed, but muscle activation. Lowering back down slowly is just as important as standing up because the muscles must control the descent. This eccentric muscle activity is extremely valuable for maintaining strength and protecting joints. Even performing 5 to 10 slow repetitions each morning can begin activating the muscles that stabilize the knees and hips for the rest of the day. Over time, this small daily habit can significantly improve joint support, reduce stiffness, and help maintain the ability to move confidently without pain. Another movement orthopedic surgeons frequently recommend focuses on hip stability, which plays a critical role in balance and fall prevention. The hips act as the central control system for the lower body. When hip stabilizers weaken, the body becomes less steady during walking and standing. This is why many seniors notice themselves feeling slightly unbalanced when turning, stepping sideways, or standing on one leg. A simple exercise called supported single-leg balance can begin restoring that stability. Standing near a counter or sturdy surface for support. Slowly lift one foot just a few inches off the ground while keeping the body upright. Even holding this position for 10 to 20 seconds activates deep stabilizing muscles around the hips, core, and ankles. These muscles function like a natural brace for the joints. Over time, they help the body react faster to small shifts in balance, which is critical for preventing falls. Orthopedic doctors often say that balance training is not just about standing still on one leg. It is about teaching the nervous system to coordinate muscles quickly and efficiently. The brain and muscles communicate constantly to keep the body upright. As people age, that communication can slow down if it is not practiced regularly. Small balance exercises stimulate the nervous system and keep those reflexes sharp. Another overlooked area that orthopedic specialists focus on is the spine. Many seniors experience stiffness in the lower back and assume stretching is the best solution. However, doctors explain that the spine is designed to be supported by surrounding muscles rather than simply stretched. One gentle movement often recommended is the standing pelvic tilt. This exercise activates the deep abdominal and lower back muscles that stabilize the spine. Standing upright with knees slightly bent. Gently tilt the pelvis backward to flatten the lower back slightly, then return to a neutral position. This subtle motion engages core stabilizers that protect the spinal joints from excessive pressure during walking and lifting. Over time, strengthening these muscles can reduce chronic back discomfort and improve posture. When you combine movements like controlled sit-to-stand, supported single-leg balance, and gentle spinal activation, you begin addressing the real foundations of mobility, strength, coordination, and joint stability. These are the qualities that allow seniors to walk confidently, climb stairs, carry groceries, and remain independent for years longer. And the remarkable part is that these movements require only a few minutes each day. They are not intense workouts, yet they send powerful signals to the body to maintain muscle tissue, support joints, and keep the nervous system responsive. In fact, many orthopedic doctors say that consistency matters far more than intensity when it comes to preserving mobility after 60. Small daily movements practiced regularly can have a profound effect on how the body ages. In the next section, we'll reveal another habit orthopedic surgeons strongly recommend for protecting joints that many seniors completely overlook, and why skipping it may accelerate joint stiffness and cartilage damage over time. Another habit orthopedic surgeons strongly recommend for adults over 60 has nothing to do with stretching or even traditional exercise. It has to do with how often you move throughout the day. Many seniors believe that doing a short workout in the morning is enough to protect their joints. But orthopedic specialists warn that long periods of sitting can quietly undo many of the benefits of that activity. When the body stays still for extended periods, the joints are not receiving the natural lubrication they need. Cartilage inside the joints does not have its own blood supply. Instead, it depends on movement to circulate synovial fluid, a thick liquid that nourishes cartilage and allows bones to glide smoothly against each other. Think of synovial fluid like oil in a machine. Without regular movement, it becomes thicker and less effective, which is why joints often feel stiff after sitting for a long time. Orthopedic doctors often recommend what they call movement snacks throughout the day. These are small bursts of movement lasting 1 to 3 minutes that help reactivate muscles and circulate joint fluid. Something as simple as standing up every 30 to 40 minutes, walking around the room, or performing a few gentle leg movements can significantly improve joint health over time. Studies have shown that people who break up long sitting periods with short bouts of movement experience less joint stiffness, better circulation, and improved metabolic health compared to those who remain seated for hours at a time. Another powerful but often overlooked habit for protecting joints is maintaining adequate protein intake. After the age of 60, the body becomes less efficient at building and maintaining muscle tissue. This process, known as anabolic resistance, means that older adults require slightly more protein than younger people to preserve muscle mass. Orthopedic specialists frequently emphasize that muscle acts as the body's natural shock absorber. Strong muscles reduce the mechanical stress placed on joints during everyday activities. Without enough protein and resistance-based movement, muscle tissue gradually declines, leaving joints more exposed to strain and degeneration. That is why many doctors recommend including a good source of protein with each meal, whether it comes from fish, eggs, poultry, dairy, beans, or other nutrient-dense foods. Combined with regular movement, proper nutrition helps maintain the muscular support system that protects the skeleton. Hydration is another factor that plays a surprisingly important role in joint health. Cartilage is made largely of water, and when the body is dehydrated, the tissues inside the joints can become less resilient and more vulnerable to wear. While drinking water alone will not cure joint pain, staying properly hydrated helps maintain the elasticity of connective tissues and supports overall cellular function. Orthopedic surgeons often advise seniors to drink water consistently throughout the day rather than waiting until they feel thirsty, because the sensation of thirst tends to weaken with age. Sleep also plays a critical role in joint recovery and muscle maintenance. During deep sleep, the body releases growth hormone and performs many of its most important repair processes. Poor sleep quality has been linked to increased inflammation, slower muscle recovery, and greater perception of pain. Many seniors notice that joint stiffness and discomfort feel worse after a restless night. Establishing consistent sleep habits, reducing late evening screen exposure, and maintaining a comfortable sleep environment can make a significant difference in how the body feels each day. When orthopedic surgeons look at seniors who remain active and mobile well into their later decades, they often notice a pattern. These individuals rarely rely on just one habit. Instead, they combine several small daily behaviors that work together to support the body. They move regularly throughout the day rather than sitting for long stretches. They perform simple, strength-based movements that keep stabilizing muscles active. They eat enough protein to maintain muscle tissue. They stay hydrated and prioritize sleep. None of these habits are extreme or complicated, yet together they create a powerful system for protecting joints and preserving independence. The truth is that aging does not automatically mean losing mobility. Many people in their 70s, 80s, and even 90s maintain excellent movement because they continue sending the body the signals it needs to stay strong. Muscles adapt to the demands placed on them. Joints respond to movement. The nervous system stays sharp when balance and coordination are practiced. But when the body stops receiving those signals, decline tends to accelerate. This is why orthopedic surgeons emphasize that the goal is not to avoid movement, to move in ways that support the body's structure. Gentle strength movements, balance practice, regular activity, proper nutrition, and good recovery habits can dramatically change the way the body ages. If you are over 60 and want your knees, hips, and back to continue supporting you for years to come, remember this simple principle many orthopedic specialists share with their patients. Flexibility alone is not the foundation of mobility. Stability, strength, and consistent daily movement are what truly protects your joints. By building these habits into your routine, you give your body the best chance to stay active, confident, and independent for decades ahead.